When it comes to, mothering, just let's talk about young girls first. What are some of the things that you look out for when it comes to hormone health?
So I have twin daughters who are 17 right now, and my son is
Good.
15. So this is,
Right.
right in that time
Yep.
where I do think that that advice is important. I've talked to them a lot, and they don't always want to talk to me. So they're always they kind of close their ears, but I still talk, and I hope that I absorb some of it. But I've talked to them about hormones. I think making sure again cycles are regular, and that I think if you're having any severe symptoms, like any severe PMS symptoms, or heavy bleeding, or migraines before your migraines every month, or debilitating symptoms, like that is not normal. Like, it is not something that should be normal. It is not optimal. It's not okay. And that should be something that should be discussed with your doctor, and then they hopefully will actually address it. I've also talked to them about birth control, and when you need it, like what are the options. I was on birth control for like 15 years myself, like just the pills. I had no idea that there was maybe way worth a better way potentially.
Yeah.
So I like to have the discussions about what birth control is kind of like. To me, it's like a kind of a hostile takeover of your body. Like, it's
Yeah.
these synthetic hormones at very high doses that you're
Yeah.
taking in, and certainly it has a purpose, and I'm
Yep.
glad that we have access to birth control pills, but also it's a hostile takeover. It's taking over the way that your brain communicates with your ovaries.
Mhm.
It's taking over a lot of your own pathways, and I think that there's a time and a place for it. But I also think that we could probably not give birth control quite as often in that way, if people knew kind of the increased risk of blood clots, and potentially breast cancer down the line and things like that. So just thinking through the positives and negatives of some of those kinds of things. Certainly the lifestyle piece continues to be important, but at where my kids are, it's more about like how can we safely get you through like your 20s,
Yeah.
and those kinds of years where there's some tough decisions to be made.
What are some of the things that you're still the most concerned about, whether it be kind of fertility rates or these issues, diet, lifestyle? What are some of the things that you're most concerned about over the next decade? And then what are some of the things that you're most optimistic about?
I am probably the most concerned about just climate and environmental problems, environmental toxins, environmental, issues, climate change, whatever your political views on this. We
Yeah.
know that things are going in a worse direction,
Mhm.
and I think that if we don't have clean air and clean water and clean soil, then virtually like nothing else really matters that much.
Yep.
And that we as humans continue to pollute around us, and
Yeah.
are not really being supported in that. So that's my biggest concern, honestly. Fertility rates going down does concern me for
Yep.
sure. I think that that is something that is a direct reflection of lifestyle and
Yep.
the climate and
Yep.
the toxins in the environment. So that worries me as well. I'm optimistic around just the learnings that we're getting from all of this data. I do think
Yeah.
that we're going to make some strides in terms of improving personalized medicine,
Mhm.
improving being able to help on a one-on-one kind of basis. I'm
Yeah.
hopeful and a little concerned about how we're going to get that information to the masses, to all the people around the planet, many of whom can't afford to go to a
Yeah.
functional health doctor and pay out of pocket and get all these tests done. So I think that that's something I'm hoping we can kind of figure out, but I don't see a clear path to that right now.